Hi, everyone. My name is Brett Ray. I'm a licensed California acupuncturist and the newest member of the team at Kunde Institute. I'm really excited for the opportunity to work with Dr. Yangjun Kalsang and the rest of the team at the Institute. Um, so this autumn, we decided that it would be a good idea to do a little presentation about Chinese medicine understandings of immunity and talk a little bit about what's involved in all of that as we prepare to transition into our autumn season and our winter season. Cold and flu will be on the rise, and we want to make sure that all our patients know how to take care of themselves and to do the best practices for prevention of cold and flu. So I'm going to share a little presentation here. So here's our Eastern medicine approaches, Chinese medicine, cold and flu prevention and care. And when we talk about immunity in Chinese medicine, what we're talking about is an understanding based in qi. Qi is a really big topic, so I won't get too deep into it, but I will say that qi not only describes a kind of energy, but it also can describe substances and functions in the body, but also in the world at large. Everything has a certain kind of qi, which is a certain kind of dynamic or a function. And so when we're looking at the body, especially the immunity, we have different kinds of qi, different functions in the body that do cover these concepts and these ideas. So for instance, we have the defensive qi and the upright qi. The upright qi has its basis in digestion, in our nutrition. So proper nutrition is actually really important in Chinese medicine and in Eastern medicine in general. If you've had some exposure to Ayurveda or Tibetan medicine, then you'll know that food is medicine, right? So the nutrition does provide the basis for the formation of the upright qi. And there's an entire school of thought, which I'll talk a little bit about later, which was all about strengthening this earth element, which is our digestion, in order to make a healthy body. And in addition to the upright qi, which on the inside protects us from infections and disease, we also have the defensive qi. The defensive qi, or the wei qi, controls the surfaces of the body, including the dermis, the epidermis, the sweat, mucus, and our lungs. Our lungs are seen as the only internal organ which is also coming into direct contact with the outside. And because of that, as you see kind of in our little infographic on the side, infection can come into our nose and into our mouth as we breathe that into our lungs. So the lungs are often the first organ affected by infection or allergens in our environment. As we've all thoroughly experienced in the last couple of years with the COVID-19 pandemic, the use of a mask has protected many people from these kinds of infections. So protecting our lungs is really important. And we aid ourselves and our immune system when we do take these precautions. And this understanding of defensive qi is actually really closely allied with our Western view of the immunity, as seeing the skin as the first line of defense, because the skin also contains these immune competent cells like lymphocytes, leukocytes, macrophages, and a host of other immune competent cells that know how to deal with infection, basically. So our skin is protecting us against toxins and pathogens in our environment, and it keeps them from penetrating deeper in, creating more long-term issues or more serious conditions. Because Chinese medicine is something of a holistic medicine, you can find many different connections with each individual concept to the rest of the body. But when we're talking about the formation of immunity or the basis of immunity, we're really focusing on three organ concepts: the concept of kidney, spleen, and lung. And these are also our three roots of our energy in our body as well. The kidney represents the constitutional, what we receive right from the outside of our lives, our kind of ancestral endowment that we get from our parents. We also have our nutritional basis, which is from the spleen and the stomach, and then the kind of energy that we get from the lungs, from our pure environment that we're breathing into our lungs, the oxygen. Any deficiency in these three systems can cause a deficiency of immunity or being a person who is prone to illness. I maybe wouldn't go as far as to say immune compromised, just because of all of the associations that that has. But if you kind of frequently get colds in the spring or in the autumn, and maybe some of your peers are not getting sick as frequently as you, it could be because of a constitutional, a nutritional, or a respiratory deficiency. And then, as I said before, internally we have the upright qi, and this includes the defensive wei qi, but it also has involved in it the nutritive qi and our kidney yang, or our kidney essence. In terms of Western correspondence, aside from innate and acquired immunity, there's also an agreement on auxiliary functions as well. So maybe constitution, our age, if we have some sort of bone marrow deficiency, chronic stress, which we frequently think of as attacking the adrenals or the kidneys, and insomnia. These are all factors that can contribute to what we might see in Chinese medicine as a kidney deficiency. And it's also understood that obesity, poor diet, malnutrition, and certain micronutrient deficiencies can lead to a poor functioning immune system. Western medicine is a little bit cautious about saying, taking a certain vitamin or eating a certain food can increase your immunity. But the reverse is seemingly supported by Western medicine research, that the deficiency of these things does lead to poor immune functioning. So you have to kind of understand that maybe taking more zinc might not be enough, but in the grand scheme of things, making sure that you have proper nutrition does help with your immunity. And then in terms of the lungs, air pollution, airborne diseases like COVID-19, pollen, and other environmental allergens can also trigger the immune system or negatively impact the immune system. So there's plenty of shared agreements between Western and Chinese medicine there as well. Chinese medicine traditionally has different kinds of views of different pathogens depending on their nature and the season that they appear in. Again, this is like a qi-based worldview. So we have different kinds of qi that are more prevalent in different seasons, different times of the year. Hot type diseases are obviously going to be more prevalent in the summer, which is the hottest time of the year. Whereas in the winter, we're going to see more cold types. So we have the hot, summer heat, cold, we have dryness and dampness, and we have wind. Sometimes these are called the six evils, or the six pathogens, the external pathogenic factors. They have many names and translations depending. And in addition to that, there were also different periods of time in Chinese medicine that theories and approaches were conceived of and developed, like the Shanghan school, the cold damage school, which originated with Zhang Zhongjing. And this concept is that all disease that originates from the outside is some form of cold damage, that we receive an invasion of what's conceived of as wind cold, which then transforms within the body and can have hot expressions. The way that we translate wind cold could be a huge number of diseases that have Western names, but for the purpose of this talk, I think we'll probably just leave it at that, and maybe talk about Shanghan ideas a little bit more in the future. And then similarly, but on the other side of the coin, we have the Wenbing school, which says almost the opposite, which is disease originates as wind heat. We think of wind cold and wind heat as the cold and the flu, oftentimes. So both of these schools are saying maybe bacteria and viruses are the causes of disease, and they have different manifestations as they invade the body. And then the Earth School, or Tonify the Earth School, is a school of thought in Chinese medicine that really focused on nutrition and digestion as being the cornerstone of health. And without having a proper functioning digestive system, our immunity wasn't going to be functioning properly. And it's very difficult to take herbal medicine as an internal cure because the spleen in the stomach isn't strong enough to be able to process those herbs and use them in a functional way. So what is a wind cold, right? So according to the Shanghan Lun, the onset is rapid and there are rapid changes in signs and symptoms. That's like the nature of wind. The wind moves very fast. So we see that kind of qi in the presentation of a wind cold. There's also shivering and stiffness. This is more like the cold kind of qi. And because the lungs are exposed to the outside through our breath, it affects the lungs first, and it affects the skin, causing itching. Wind cold symptoms also include, as I've mentioned, the aversion to cold or wind. It can transform into a fever, has occipital stiffness, which is the kind of stiff upper back and stiffness in the neck. It can cause a headache, runny nose, sneezing, coughing, itchy throat. And there's possibly sweating, possibly not, and a floating pulse. And then from the Wenbing understanding of illness, the warm disease theory, we have similar expressions to external wind or the wind-cold invasion, but there's also an inclusion of signs of heat. So the heat signs specifically are thirst, because when it's really hot out, we're more thirsty. The yellow mucus, kind of like in the same way that sulfur has a hot expression, we get this like yellow, almost like burnt quality to the mucus. There's more of a fever. There's a rapid pulse because fire is rapid, and the red tongue, which shows heat. And in the Wenbing Xue, we have the fever, aversion to cold, headache, sore throat, slight sweating, runny nose, yellow discharge, maybe swollen tonsils and body aches, slight thirst, red tongue, floating, rapid pulse. And again, maybe in the future, we'll do separate posts on the Shanghan Lun and the Wenbing Xue, going a little bit deeper into what's going on there. But those are the main ideas behind wind cold and wind heat. And the important thing to know is that the kind of medicine that we do addresses all of these concerns. So principally, we have acupuncture and moxibustion. Acupuncture modulates the constituents of the immune system, stimulates an increase of T cells, red and white blood cells. So this helps in indirect ways with inflammatory responses, circulation, stiffness, and our energy. And so it helps symptomatically to treat recovery from illness. So it has that two-sided functioning, basically. So as a preventative method, it can be really good for stimulating the immune system before we're exposed to some sort of pathogen or illness, but it also can help with the recovery aspect as well. And then classically, moxibustion is said to expel wind and cold. It warms the channels, moves the blood, supplements the yang qi, treats deficiency, and prevents disease. In Bianque's Heart Teachings, which is a classical text from the famous physician Bianque, he says that moxibustion in times of health strengthens the immune system, restores energy, and promotes longevity. So this is really important as a classical sign of how to prevent illness. It's saying when we're well is when we should be getting our treatments. That way we can bolster what we already have as defense against pathogens. When we're already sick, we're kind of having to deal with things that are already maybe advancing past our ability to fight them off by ourselves. So it's better to be preventative in the kind of care that we have. In addition to acupuncture and moxibustion, we also have cupping and Gua Sha. Up above on the first image, that's the cupping, and then below we have the scraping. It looks like they're using some sort of stone to do the Gua Sha. Cupping and Gua Sha specifically dredges the channels, the various meridian pathways in the body. It vents heat and releases the exterior and moves the blood. So it's really good for pain that kind of follows the course of specific channel pathways. It deals very well with internal heat or external heat generated from an invasion. It helps with wind heat and local type blood stasis pain. And then from the Western medical perspective, it upregulates the TNF cytokines and interferon. So this helps with inflammation. And when the marks from Gua Sha and from cupping reintegrate into the body, a host of chemicals that are antioxidant, anti-inflammatory, and neuromodulatory are converted. So you have the HO1, the BV, and the BR, bilirubin and biliverdin, I think, and then the CO. So these all have these kinds of properties that help with inflammation. In terms of treatment modalities, we also have herbal medicine, which is a very important part of the tradition of Chinese medicine. In the preventative and early stages, it supports constitutions that have weakened immunity. So if you're already prone to infection, then it's a good idea to take herbs when you're thinking that you're going to get sick, so that you can make sure to supplement your immunity. It also helps us to stay healthy and balanced and keep our defenses strong. And then if you're feeling like maybe you were exposed to someone who was sick, or you were in a place where your immune system might have been compromised, then it's a really good idea to be mindful and be aware of those early first symptoms to be able to take the appropriate medicine so that it doesn't advance into a more serious condition for yourself. And in the case that it does penetrate deeper, then we also have herbal formulas that are designed to treat the illness as it progresses through the various stages of its development, thanks to the ideas that were developed by the Shanghan and the Wenbing schools. And as we mentioned in the beginning, from the Tonify the Earth school, nutrition is also super important because food is medicine. So many medicinal herbs can be found in the herbs and spices aisle in the grocery store, and sometimes fresh herbs, if the season is right, can be used in that sort of medicinal way. This is part of this idea that everything has a certain kind of qi. So it has maybe warming properties or cooling properties or aromatic qualities. So we can use all of these things in our day-to-day lives to help make sure that we're balanced and we're supporting our health and our wellness. Some other tips for self-care during cold and flu season, coming from Chinese medicine ideas or Eastern medicine ideas, is avoiding exposure to the elements. If it's cold or damp or windy, after a time that we've really opened up our pores, we've opened up our skin, like exercising or taking a hot bath, we are more likely to be exposing ourselves to illness. So we want to be really careful to protect ourselves in those ways. And dampness, or even like our sweat, which is maybe like a natural kind of dampness as well, can be irritating and can create discomfort. And if the sweat isn't washed away, then the bacteria and the fungus can develop on the skin. So that's one way, like a traditional idea can be seen even in Western medicine as a cause of infection. Cold is said to be constricting and depletes our energy trying to stay warm. So in winter, we want to make sure to bundle up and cover sensitive areas like our necks. And that helps us to maintain proper circulation. Wearing gloves so that we have warmth all the way out to the extremities is really important. And in terms of wind, we want to be mindful of airborne diseases, closed spaces, and public shared spaces. The idea of wind carries the association of airborne diseases. And so wearing masks if you're feeling sick or you have to go outside, or when you're in public spaces and you see other people are sick too, then we really need to be wearing our masks to be able to decrease the likelihood of the spread of infection. And the more that we do that, then the more likely we are to have a healthy society. So if our whole city is participating in these kinds of practices, then we'll all be better off. And our last recommendation is to join us for community acupuncture, which we're starting this week. Our open house will be on the 20th from 4:30 to 7 p.m. We'll do a short presentation about Chinese medicine and what we're going to be offering, in addition to a free treatment and a small practice of Tai Chi and Qigong. As I mentioned before and cited from Bian Que, traditional medicine is really good as preventative medicine. So even if you feel well and you don't think that you need acupuncture right now, it's a great time to make sure that we stay balanced and healthy before we transition fully into autumn and winter. So hope to see you soon at Kunde Institute, and wishing everybody very well. Thank you so much.